Top story, though, and that is a person living in Kent County has died from West Nile virus. Big news today, probably our biggest story. The county health department confirms this is the county's first West Nile-related death since May of 2024, and the first case of the year, rather. 13 on your side's Kelly Lichter reports today.
The Kent County Health Department is urging people to take caution while outside after the first case of West Nile virus in the county this year turned deadly. West Nile virus is transmitted through Culex mosquitoes, which the health department says are common house mosquitoes.
What we're seeing is with the Culex mosquitoes is that we're seeing that they are able to breed much more successfully this summer than in maybe in other summers where it's been wetter.
The Kent County Health Department's Environmental Health Director Sarah Simmons says the department starts surveillance on the mosquitoes around Memorial Day weekend, lasting through Labor Day. The department says the person who died lived just 3,000 feet from where the virus was detected in mosquito samples. Symptoms of West Nile can range from no symptoms at all to mild flu-like symptoms to serious neuroinvasive disease in less than 1% of cases.
It can cause different symptoms like paralysis and extremely high fever, stiff neck, meningitis, other things, and that can be much more severe and cause lifelong problems and even death.
Program Supervisor of Communicable Disease Kathy Armstrong says it's significant the only case in the county so far this year was also deadly.
Some people have higher risks than others. For example, people who are immunocompromised or people who have other underlying health conditions, they can be at more risk for these more severe illnesses.
But early to mid-August is when they start to expect cases to pop up. There isn't really a treatment for West Nile virus, but there are ways to reduce the chance of exposure.
Keeping your lawn trimmed to prevent wet spaces for mosquitoes to breed would be cleaning out your eaves troughs.
Wearing the mosquito spray and wearing light colored and long sleeve clothing and taking those precautions.
Although West Nile virus can be serious, Simmons and Armstrong say it shouldn't stop anyone from enjoying their time outside.
And Kelly joins us now. Kelly, I think sort of the end of that story there is what sticks with me the most. You know, you don't need to stay inside for the rest of the nice weather, but we've been talking about the precautions all summer of things you can be doing. Anything else to add there just on, don't be scared to go outside. Just be thinking about this if you're, going to be spending a prolonged period of time.
Yeah, I feel like that's always the message, whether it's mosquitoes, ticks, some of these things that, there's the chance that these insects can be harmful, but there's also the chance it could be like a run-of-the-mill mosquito. You don't know when you see a mosquito that's going to be, able to give you like West Nile virus. So exactly what you said and exactly what was repeated by Armstrong and Simmons in that story, don't limit your time outside this summer when it's gorgeous and beautiful. Maybe not recently, it's been a little bit chilly.
Yeah.
But like they said, making sure that areas don't get too wet, because that's where mosquitoes like to thrive. But mosquitoes also can thrive in, dry areas. But just, normal mosquito procedure, what you would be doing to prevent mosquitoes normally, limiting those areas, covering up when you go outside, using, an approved bug spray. There's some bug sprays out there that, aren't approved and may not prevent against those bug bites, mosquito bites, as well as some others. So using a tested, approved mosquito spray when you go out, covering up, and those are great ways to, still enjoy the outside while keeping yourself safe.
Yeah, and something else you mentioned while your story was playing too is even if you were to get West Nile, it doesn't necessarily mean that your case ends up unfortunately like the one we're reporting on today.
Yeah, I do believe it was Armstrong who said during the interview it's 1% of these cases turn into those neuroinvasive, I believe was the term. Cases that, can seizures, death, all those
the more serious
bad things, the serious complications. There is a large percent of people who get bit by a mosquito that can transmit West Nile virus that don't have any symptoms or just have those mild flu-like symptoms. So just because you get bit, just because you get infected, does not mean that you are automatically going to die. I know some people like myself get freaked out about it.
Yeah, but percentages, incredibly low, but still important. You never know, when a mosquito in your area, wherever you are, could have it. So good to keep those tips in mind, the light clothing, emptying out bodies, any pooling of water in your yard.
And they did say that August is the time where they start to see these cases. They were not surprised that this person was reported to have West Nile, I believe, last week, 2 weeks, whenever it was reported to them, they were not surprised to know this individual was infected with West Nile. And they say, unfortunately, it's early to mid-August is when they start hearing the reports. Mid to late August is when they see if they are going to see deaths, that they see deaths. The last time there was a death from West Nile in Kent County, I believe, is May of last year.
Well, and the Kent County Health Department and our other local health departments keep us very in line with when we learn about a new case or we learn about a death or some sort of serious illness. So they keep us updated constantly with when we have news like that.
And they have a very in-depth mosquito tracking program, and they really go out into the community and, kind of track these mosquito populations, mosquito pools, and, like they told us, they found out that this individual who contracted West Nile virus was living, 3,000 feet, I believe, from, an infected population.
From where we had seen those.
Yeah. So, they're up to date with testing. They kind of know where these populations are, and it's sent to a state lab as well to, verify that information.
And can people at home, can they access any resources that look into that tracking analysis and information? Is that available online for people if they're interested, do you know? I might be putting you on the spot there.
Yeah, that's a very good question. Usually when I come in, I kind of know what you're going to say. If there isn't resources online, the Kent County Health Department is very responsive. They love to talk to people. They love to inform people. They also do a lot of events that reaches out to the public to have them come along on, other things that they do. So I'm sure if that information isn't readily available online, definitely reaching out to the county health department. They would probably love to chat to you about it.
Yeah. All right, Callie. Well, we know we'll continue, of course, to follow this topic as summer sort of winds down. But thanks for your reporting today and for kind of breaking down some additional facts. We appreciate it.